Hello and welcome. My name is Dr. Rizwan Qureshi and I'm one of the consultants in emergency medicine working here in Sydney, Australia. One of the most important questions that medical students and junior doctors ask themselves is what is the most suitable medical specialty for them to train in? Obviously, this is a question which is based on a number of different factors: their passion, their personal interests, also financial gains, and maybe some inheritance. It's not unusual to find a family of neurologists, general practitioners, psychiatrist, cardiothoracic surgeon. But I think in this era of medical specialization, one needs to take a very sensible decision. For the purpose of this video, I'm going to break this conversation out in the following parts. Number one, your personality and your personal choices. Number two, your financial gains. Number three, what are the steps of choosing a medical specialty? Number four, we're going to bust some myths associated with certain medical specialties. And number five, I'll give you my personal opinion of what specialties have a good projected growth over the next number of years. A little disclaimer, most of the views expressed in the video are my observations and my research. Obviously, if you're choosing a specialty, it should be based on wide consultation between you and your family members and your mentors. Number one, personality. If you're a kind of person who's not seen the sunrise for the last 6 months or so, then acute medical and surgical specialties in the hospital-based medicine are perhaps not suitable for you. They start their day really early on with a ward round and then going to theatre and then coming and taking further responsibility of more ward round clinic responsibilities. If you're a late riser, you need to be choosing a specialty which is flexible with the rosters, something like emergency medicine, ICU, psychiatry, some academic responsibility in which you can have some days off and some days on. If you like working in big teams, then perhaps hospital medicine is more suitable for you. In hospital medicine, you've got patient care and delivery, but also you've got other satisfying bits of the job like training and teaching your registrars, the medical students. Also, it's a very social job in which you go and meet people every day, not only your patient, but people from other parts of the medical, nursing and allied health team. So hospital medicine is more suitable for people who like to be along with a large number of people and provide team-based care. If you like to work alone, then perhaps a general practice, pathologist or radiologist might be more suitable for you. You can still get the majority of your work done without involving any other person. However, even these specialties are more holistic these days and involve team-based care, as the modern medicine is all about team-based care. If you have financial gain and entrepreneurship in your mind, then choose specialties which offer a variety in terms of having a large number of private consultation, blend of small and big procedures, and perhaps a future of growth and potential in terms of your private work. The specialties like neurosurgery, ophthalmology, ENT, cardiology, and plastic surgery, all of these specialties provide a good potential for private patient growth. However, if you're not really fussed about that, then specialties like emergency medicine, ICU, critical care do come along with fixed wages. In the recent years, we've seen a lot of growth in these specialties, so you can still locum a lot and still take home a decent chunk of salary. However, I'd like to emphasize on one point: being an entrepreneur is more about than just choosing a specialty. It's a whole different mindset, which is a bit beyond the scope of this conversation. Before you even decide that particular specialty to train in, you need to make sure that you train for at least 6 to 12 months in that particular specialty. That will give you a fair idea about the aspects of the patient care related to that specialty, the roster. Also, talk to the registrars and consultants who've been working in that specialty for substantial duration of time and ask them their perspective, how it feels to be working there for about 5 years or 10 years and what's the growth and prospects like. Also, when you're choosing a specialties, be very careful that you should be easily be able to get a training post into it. There are certain specialties like ophthalmology, the cardiothoracic surgery, neurosurgery, orthopedics, plastic surgery, which have a very few number of trainees every year. And if you're not cut out to do a lot of research and staying in the hospital long hours, then perhaps avoid those specialties because they're going to take a lot of time to get into the training positions. Certain specialties which take their trainees without much fuss. These specialties include ICU, acute medicine, basic physician's training, basic surgical training before you even decided about certain specialty, and mental health as well. Always ask yourself a question: where do you see yourself in 5, 10 and 15 years time? And if you know that this is the specialty for me, then go right ahead and invest your time and future and all the study and training in that particular specialty. But if you're not sure, then please don't rush in and spend more time in that specialty. If you're still not sure, then perhaps the best advice I can give to the junior doctor: do more general specialties in the first 2 years after your house job. These are also called foundation specialties in the UK or basic specialties here in Australia. These are blend of acute medicine, acute surgery, pediatrics, intensive care and emergency medicine. These are the specialties which build your foundation, and no matter what specialty you end up choosing later down the line, the experience and the training learned in these specialties will still help you progress better in your chosen specialty in the future. More than 2/3 of the medical workforce are women, and if you're planning on having a family, then choose a specialty which can provide a flexible training options. Most of the medical and surgical specialties in a hospital setting do provide that option. As a rule of thumb, I would like to advise that if you're going on a maternity leave for 12 months, then come back part-time, but don't spend more time, because every time that you spend out of medical practice, it will take equal amount of time to regain your confidence back into that medical specialty. For instance, if you've been out of medical practice for about 12 months, it will take you 12 months more to start back where you left off from. Most of the hospitals and training programs are making allowances to retrain the doctors who were once in training, but because of family commitments, they had to leave the training. To please engage in those conversations with your trainers, with your mentors, and with the hospitals and the colleges, so that you don't miss out in terms of your specialist training. There's nothing worse in taking up a very good training program and leaving that halfway through. Myth bustings. Be your own boss. There's certainly no specialties in which you can be your 100% boss. In modern medicine, all the specialties are delivered as a part of team-based care. So you would find yourself working in large teams of nursing staff, allied healthcare staff, managers, administrative staff, and you'll be a small component of that team. Certainly you can gain more hierarchical structure as you progress along and become more senior, but certainly you'll be making a lot of deadlines, lots of challenges, and a lot of tasks associated with that. Myth number 2. As the time progresses, things get easier. This is certainly not the truth. So you will feel that as you're progressing in your career, your work is definitely different, but at the same time, it is becoming more challenges because you're more answerable. The buck stops at you. So make sure that your responsibilities are met in safe and effective manner. Myth number 3, there is no need for specialization. This is certainly the biggest myth of all. In this day and age, everybody wants to be treated by properly qualified and properly trained doctor. Trust me, if you're unwell, you would probably do the exact same thing. Even if you don't want to specialize, there are plenty of other fields of medicine or academics that you can go and spend your time with, but don't leave it at just simple or plain MBBS. Lastly, I'd like to talk about some pandemic-proof specialties or specialties which have got future prospects of potential growth. These are the specialties which we've seen in the last few years which have survived because they're considered essential to human survival and mental well-being. Specialties like emergency medicine, ICU, general medicine, and psychiatry. Telemedicine has completely revolutionized the care which is delivered to the patient these days. So if you belong to any of these specialties, acute medicine, general practitioner, or a psychiatrist, these are the specialties which can continue to work pretty much at the similar pre-pandemic level through their telemedicine component to it. Also, telemedicine is now big in developing countries where the infrastructure of building a new hospital are really not there, and these technological infrastructure really help delivery of safe and in fact more better care in certain instances in those parts of the society. So do consider whatever specialty that you're choosing has or can have a patient delivery mode through telehealth platform. And lastly, I'd like to end this conversation with a beautiful poetry from Urdu language. Hazar barq gire lakh aandhiyan uthin. हजार बर्फ गिरे लाख आंधियां उठीं वो फूल खिल के रहेंगे जो खिलने वाले हैं. The point that I'm trying to get across through this particular poetry is that if you're passionate about a certain medical specialty, please go right ahead and do it. Don't waste time. Medicine rewards for commitment, enthusiasm, staying put, as in any other field of life. It does not really matter what are the various influences, what your friends are doing or what have you seen other people doing. The point which matters is that if you're really passionate about a certain medical specialties, go ahead and do it and stay committed to it. Everything else in terms of your personal commitments, your family commitments, and professional growth and financial gains will sort itself out. I hope you find this conversation useful. Please subscribe to our YouTube channel Emergency Focus and look after yourself and look after each other. Thank you very much.